It was further reported that survival was better with Iscado-P than with Iscado-M, and with longer treatment duration. However, no data were presented to this point, so it is hard to judge. Now I want to give you a short introduction into cohort studies. Also here we did quality assessment, criteria-based, and the criteria are, of course, a little bit different than the other trials, because different points are more important here. Cohort studies means just one group of patients that are not compared to other patients. 9 prospective trials were included. 9 prospective cohort trials included 192 patients. You can see the cancer sites. 5 trials were on solid cancers, 1 on SIN, and 3 on malignant infusion. Mistletoe extracts were applied subcutaneously in 6 trials, intratumoral in 1 trial, intrapleural in 2 trials, and intraperitoneal in 1 trial. Of the 5 trials with solid tumors, in 3 trials, the patients were treated conventionally already and had exhausted all conventional treatment options. And the 2 other trials had patients that had no conventional treatment because they were inoperable or not choosable. And the point of on the right, you can see, I just explained you this table. On the left, you can see author and year. Then you can see tumor site. Then you can see tumor behavior and quality of life. N means the size of the studies. And on the right, you can see the result of the criteria-based quality assessment. And the point O means whether they make a statement on additional therapies. And if it has an O, it means that they had additional oncological therapy, which was just the case in 1 trial. But this trial had no remission anyway, so it doesn't matter. Of these 9 cohort studies, 3 reported remission of solid tumors in 22 to 64% of patients. 3 reported remissions of malignant effusion in 77 to 88% of patients. 1 reported remission of SIN in 68% of patients. And 2 reported stable disease beside progressive disease, but no remission. Time to remission of solid tumors was 4 to 6 months in 2 trials. Besides 5 trials reported an improved and 1 decreased quality of life. 3 of these trials were conducted in Egypt. One of these is published by Mahfouz, a former health minister. And it was conducted in 9 Egyptian cancer centers in university hospitals on 26 patients with advanced breast cancer. They were treated conventionally with all conventional therapy options, and they had exhausted all treatment options. And now they were treated differently than mistletoe therapy. Usually mistletoe therapy is given subcutaneously in low dosage and slowly rising depending on the reaction of the patient, and it's given 3 times per week. They treated differently. They treated high dosage from the beginning on, the whole weekly dosage in 1 application just once a week. They applied it subcutaneously or intratumoral. And they treated for at least 16 weeks, and 18 patients got it longer. They reported overall remissions in 62% of patients, complete remissions in 8%, and partial remission in 54% of patients. Stationary in 35% of patients, and progression in 4% of patients. Another trial from Egypt was published last year in British Journal of Cancer. And here they treated patients with liver cancer, advanced, inoperable, who had no prior chemotherapy. 23 patients. On the right, you can see the characteristics of the patients. They also used this high dosage. And they reported an overall remission in 5 patients. That means 22% of the patients, complete remission in 3 patients after 4 or 6 months treatment. And the duration of the remission, of the complete remission, was 4 months, 29 months, or 38 months. The last 2 patients were still in remission when the report was published. Progredient were 9 patients, and not evaluable due to early death were also 9 patients. These remissions rates were regarded as encouraging, as results from systemic cytotoxic treatment are usually rather smaller in phase 2 trials. Another trial has just been published from Israel. Here, 25 patients with advanced colorectal cancer that were resistant on chemotherapy were treated with mistletoe treatment. They again used the conventional low dosage, slowly increasing 3 times per week. They couldn't find any remission, but stable disease in 84% of patients, and a symptomatic relief in 40% of patients.